What if your kitchen cabinet holds natural solutions that could help support healthy blood pressure levels? Today, we're revealing 10 powerful herbs that research suggests may help lower blood pressure naturally. What is hypertension? Hypertension, or high blood pressure, is a chronic condition where the force of blood against artery walls is consistently too high, typically 130/80ths mmHg or higher. It forces the heart to work harder, often causing no symptoms, silent killer, while damaging organs like the heart, kidneys, and brain over time. Why it's dangerous? Hypertension, or high blood pressure, is a chronic condition where the force of blood against artery walls is consistently too high, typically 130/80ths mmHg or higher. It forces the heart to work harder, often causing no symptoms, silent killer, while damaging organs like the heart, kidneys, and brain over time, silent killer concept. Hypertension is called a silent killer because it typically shows no symptoms for years while silently damaging arteries and vital organs. Many people are unaware they have it until a major, often fatal cardiovascular event, like a stroke or heart attack, occurs. It is only detectable through regular blood pressure checks. Why natural approaches are trending? Natural approaches to managing high blood pressure, hypertension, are trending due to a growing desire for safer, more accessible, and lower-cost alternatives compared to conventional pharmaceutical drugs, which often carry unwanted side effects. As of 2026, over 1.4 billion adults worldwide have hypertension, driving interest in lifestyle changes like the DASH diet, exercise, and stress management to control the silent epidemic. Importance of lifestyle plus medical supervision. For individuals with high blood pressure, hypertension, combining lifestyle modifications with medical supervision is the established cornerstone of effective management. While lifestyle changes can significantly lower blood pressure on their own, sometimes matching the effect of a single medication, medical oversight ensures these changes are safe, personalized, and integrated with any necessary pharmacological therapy. Now let's start with one of the most researched heart-protective herbs. 1. Garlic. Garlic has been used for centuries in traditional medicine. Garlic is an effective natural aid for lowering high blood pressure, with studies showing it can reduce systolic pressure by an average of 7-9 mmHg and diastolic by 4-6 mmHg in hypertensive individuals. Its active compounds, like allicin, promote vasorelaxation, acting similarly to some standard medications. Active compound, allicin, how it works. Helps relax blood vessels, improves nitric oxide production, reduces arterial stiffness. Scientific findings. Studies suggest garlic supplements may reduce systolic and diastolic blood pressure in hypertensive patients. How to use raw garlic, 1 clove daily. Aged garlic extract, garlic capsules. Who should avoid? People on blood thinners. Before surgery, 2. Hibiscus. Hibiscus tea is known for its vibrant red color and tart taste. Hibiscus tea, specifically Hibiscus sabdarifa, is a natural, effective, and safe way to help lower mild to moderate high blood pressure, hypertension, when consumed daily. Studies indicate that drinking 2-3 cups of hibiscus tea daily can reduce systolic blood pressure by an average of 5-7 mmHg. How it works. Acts as a natural ACE inhibitor, mild diuretic effect, reduces oxidative stress. Studies show regular consumption may reduce systolic blood pressure significantly. How to use. 2. 3 cups daily. 3. Basil. Basil, specifically sweet basil and holy basil, contains natural compounds that may help lower high blood pressure by relaxing blood vessels and inhibiting enzymes that contribute to hypertension. While animal studies show significant promise, human evidence is currently limited to small-scale trials. Contains eugenol, an antioxidant that acts as a natural calcium channel blocker. This prevents calcium from entering muscle cells in the heart and arteries, allowing blood vessels to relax. Clinical findings. Small-scale trials suggest that supplementing with sweet basil capsules, using basil essential oil for aromatherapy, or consuming basil tea may help reduce blood pressure. Animal studies also support these findings by demonstrating reduced cardiac hypertrophy. How it works. Natural calcium channel blocker effect helps relax blood vessels. Best form, fresh basil leaves, basil tea, Supplements 4. Cinnamon. Known for blood sugar benefits but also supports cardiovascular health. Research suggests that cinnamon may offer modest benefits in lowering blood pressure, though it is not a substitute for prescribed medication. Clinical trials have shown that daily consumption for at least 8 to 12 weeks can reduce both systolic and diastolic blood pressure, particularly in individuals with prediabetes, type 2 diabetes, or a high body mass index, BMI. How it helps: improves insulin sensitivity, reduces inflammation, may reduce blood pressure and metabolic syndrome recommended, 1 teaspoon daily, salon preferred. 5. Ginger. Ginger may have a mild blood pressure lowering effect, but this is not strong or consistent enough to replace prescribed medications. Interactions. Ginger can interact with blood pressure medications or blood thinners, potentially increasing the risk of side effects. Mechanism: improves circulation, acts as natural blood thinner, reduces inflammation. How to use: fresh ginger tea, powder in smoothies, 6. Hawthorne. Traditionally used for heart health. Hawthorne, Crataegus spp, is a herbal supplement shown to significantly lower blood pressure, especially systolic, in people with mild hypertension or prehypertension, particularly when used for 12-16 weeks. It acts as a vasodilator, often recommended to improve blood vessel function and treat mild high blood pressure. Benefits: improves coronary blood flow, strengthens heart muscle contractions, reduces vascular resistance, often used in Europe for heart support. 7. Turmeric. Turmeric, specifically its active compound curcumin, may modestly help lower high blood pressure, hypertension, by reducing inflammation and relaxing blood vessels. Studies suggest consistent long-term use, for example over 12 weeks, might slightly reduce systolic blood pressure, particularly in individuals with pre-existing high blood pressure or diabetes. Active compound: curcumin. How it works: anti-inflammatory, improves endothelial function, reduces arterial stiffness, best absorbed with black pepper, piperine. 8. Green tea. Green tea can modestly lower both systolic and diastolic blood pressure, making it a helpful, natural addition to a heart-healthy diet. Regular consumption of 1-2 cups daily may improve blood vessel function and reduce inflammation due to antioxidant compounds called catechins. Rich in catechins. Benefits: improves blood vessel function, reduces LDL oxidation, supports weight control, 2-3 cups daily recommended. 9. Cardamom. Cardamom may help lower high blood pressure due to its antioxidant properties, diuretic effects, and ability to improve blood vessel dilation. Studies suggest that consuming roughly 3 g of cardamom powder daily for 12 weeks can significantly reduce systolic and diastolic blood pressure in individuals with stage 1 hypertension. Consistent use. How acts as diuretic, antioxidant support. 10. Ashwagandha. Ashwagandha is an adaptogenic herb that may help lower high blood pressure by reducing stress-related cortisol, with preliminary studies suggesting a modest reduction in blood pressure, particularly in cases of anxiety-induced hypertension. It is not a proven replacement for blood pressure medications and requires caution due to potential drug interactions. Adaptogen herb. How it helps: reduces stress-related hypertension. Ashwagandha helps reduce stress-related hypertension primarily by lowering cortisol, the stress hormone, and modulating the body's fight-or-flight response. By acting as an adaptogen, it enhances your body's ability to resist stress, which indirectly prevents the heart from overreacting to stressful stimuli, lowers cortisol. Ashwagandha helps lower cortisol primarily by acting as an adaptogen that modulates the body's central stress response system, known as the hypothalamic-pituitary-adrenal (HPA) axis, improves sleep. Ashwagandha, Withania somnifera, is an adaptogenic herb that improves sleep primarily by balancing the body's stress response and modulating calming neurotransmitters. Research suggests it works through 3 main biological mechanisms, best for stress-induced high blood pressure. Ashwagandha helps manage stress-induced high blood pressure primarily by acting as an adaptogen to lower cortisol, the stress hormone, and reducing sympathetic nervous system activity. By lowering cortisol and calming the nervous system, it helps reduce both mental stress and physical stress-related increases in blood pressure. Bonus: lifestyle habits that amplify results. Reduce sodium. Reducing sodium to under 1,500–2,300 milligrams daily significantly lowers high blood pressure by decreasing fluid retention. Prioritize fresh whole foods, check labels, and use herbs instead of salt to cut back. A 1,000 milligrams daily reduction can noticeably improve heart health, while increasing potassium intake further helps counter sodium's effects. Increase potassium-rich foods. Increasing potassium-rich foods, such as leafy greens, bananas, avocados, beans, and potatoes, helps lower blood pressure by reducing the effects of sodium. Aim for 2,600–4,700 milligrams daily by focusing on whole, unprocessed foods like potatoes, yogurt, tomatoes, and dried fruits. Potassium-based salt substitutes can also help. Daily walking, 30 minutes. Daily brisk walking for 30 minutes, at least 5 days a week, is highly effective at lowering high blood pressure, hypertension, by strengthening the heart and improving blood vessel function, offering benefits comparable to some medications. This routine can reduce systolic blood pressure by up to 11 points, reduce the risk of major cardiovascular events by 30%, and help with weight management. Stress management. Managing stress for high blood pressure involves lifestyle adjustments like regular exercise, deep breathing, for example 4-7-8 method, and mindfulness meditation to calm the nervous system. Prioritize 7–9 hours of sleep, set boundaries to reduce workload, and maintain social connections. Effective techniques include yoga, progressive muscle relaxation, and listening to music. Quality sleep. Quality sleep is a critical, modifiable factor for managing high blood pressure, hypertension. During healthy sleep, blood pressure naturally drops by 10–20%, a phenomenon known as nocturnal dipping that allows the cardiovascular system to rest and repair. Weight management. Weight management is a primary strategy for controlling high blood pressure, as even modest weight loss can lead to significant reductions in blood pressure levels. In general, every kilogram, 2.2 pounds of weight lost is associated with an approximate 1 mmHg drop in systolic blood pressure. Limit alcohol. Limiting or eliminating alcohol is a critical lifestyle modification for managing high blood pressure, hypertension, as even small amounts can contribute to elevated readings. Recent evidence suggests that no amount of alcohol is entirely safe for blood pressure management, and those who do not drink should not start. Safety and final thoughts. This is important to remember. Herbs are supportive, not replacements. Monitor blood pressure regularly. Consult healthcare provider. Small daily habits create powerful long-term health outcomes. If you like this video, subscribe, comment your favorite herb, share with someone who needs this. See you in the next video.